So if you've ever dumped a bucket of ice over your head, or if you've chased those Pokemon characters around your neighborhood, or perhaps you anxiously waited for the next episode of Game of Thrones to drop, you know what it's like to be caught up in a trend. These things are all around us and they're fun. But what if the consequences of following a trend just wasn't a few minutes of time that you lost you'll never get back? In healthcare, jumping on the wrong trend can affect careers or organizations or even the lives of our patients. So today, we're going to explore the downside of a trend. What can go wrong and how can you avoid it? I'm Bruce Spurlock. I'm a physician and healthcare leader committed to helping professionals and decision makers navigate change with clarity. On Viral Healthcare, we look at ideas that spread across healthcare, what they promise, what they cost, and what it really takes to implement them wisely and sustainably. So let's start with something important today. So most ideas begin as good intentions. They solve a problem that you might have. They find the pain point. Some leader, some reputable person promises that this framework that they adopted was transformative for their organization. Or perhaps a technology, you've never heard this one, I'm sure. They promise to make things faster, safer, easier, more efficient, more effective, more financially beneficial to you. They seem like they're all good ideas worth exploring, and oftentimes they are. But sometimes a trend spins faster, really a lot faster than our ability to even evaluate it, or something risky begins to happen and we're not really aware of what's going on. So this is what I think about. It's like momentum replaces scrutiny. That sound interesting? Yeah, it does. And when organizations do this kind of activity, when they get too excited about things too quickly, you can end up on the wrong side of a trend and it can be expensive. What does expensive mean? Yeah, dollars and cents, but let's talk about the other things that it means. First of all, realize that sometimes a trend is a good thing and it is right for you and your organization, but it might be the timing of the trend. You may have like 16, maybe not that many, maybe 4 or 5 significant initiatives going on. It's just not right. Or the organization's not ready. You're hiring a couple new people, you're reconfiguring how you're structured, and it's just not the right time for you because you're not ready. Or, this is what happens a lot of times. The implementation didn't match the promise that all these other people made. So the consequences can be significant if there's a mismatch in your organization between you and this new idea and this new innovation. Let's talk about some of the ways that things can go wrong. So the first thing is, it's really obvious. This one's not such a so surprising one, but it's the resource drain. It can actually cost time, energy, and the resources of your organization. Money can go out the window. Healthcare systems, I know that you're very powerful, very experienced, very complex, but you have limited time, limited attention, and limited operational capacity. So when a new initiative is launched, it never appears in isolation. It's one of several competing priorities, and it's going to pull resources or attention from somewhere else. And I found this early on in my career. People would start a new initiative, and I'd say, "What are you doing with the old one?" And they kind of say, "Well, it's not going away, but they're not giving it the same kind of attention." And that attention, not just with the staff, but also with the leadership. And leadership attention is powerful. It's currency in the world of organizational development. It can involve training hours, technology investment. Heck, it can invite a whole bunch of financial and other things, and it can compete with existing priorities. So when an organization commits heavily to something that ultimately doesn't deliver, the cost isn't something just financial. It's something that we talk about so infrequently called opportunity cost. The question becomes not what didn't happen because we were focused on this, but what improvement efforts slowed down because of this, or what remains to be unsolved in our organization. These are the kind of hidden questions, the opportunity costs that are real. And sometimes these opportunity costs, maybe they don't show up for a couple of years, and they can be steep. So the first one are real resource costs that are real and tangible and touchable in the organization. But the hidden one that we're talking about on this one is opportunity cost. The second thing, and I know you've all experienced this, I've experienced this, it's called initiative fatigue. So your staff, your team, health professionals, they're brilliant. They're remarkably adaptable. We saw that during the pandemic, but their time and energy isn't infinite. They can only manage so many activities. And when you add the next Baskin Robbins flavor of the month on, that's the way they perceive it. That's the way they talk about it. Something really powerful begins to happen. They develop this initiative fatigue. So what is initiative fatigue? It's not just I'm tired, I'm burnt out. What it really is they don't engage. I mean, think about that. When you're talking about a change initiative, you need the engagement of key personnel. And in fact, you ultimately need the engagement of your entire organizations. So people come to meetings, people sort of raise their hands, shake their heads up and down, dashboards are built, but the energy is gone. It's just zero, or the enthusiasm is zero. And it's only unless you can provide obvious signs of benefit that it becomes meaningful to them. So once you lose that idea and trend from that excitement, that energy, trust erodes. And even the good ideas, the ones that people should be adopting, struggle to gain traction because of initiative fatigue. All right, the one that I know you probably thought about, but it sometimes needs to be reinforced, is this idea of leadership credibility. So if you underestimate the power of a failed or too many things going on simultaneously, the price you pay is credibility with your team. When a leader's champion has new ideas that fail dramatically, their judgment is questioned. It's like, does this person really have the discernment that we need? And the important part is that, as I've said many times, we need innovation. We need new ideas. Healthcare has a lot of things it needs to fix. And so we need to be continually open to these new ideas. But if you lose credibility because people don't question your judgment, they don't think you have good discernment, they don't really want to follow you, that's sort of the essence of losing leadership skills and the power that goes beyond your current job. So I think the important part is to think about what's going to happen to the way people think about me if we're failing in this organization. And that's a sort of a risk decision that you have to analyze before you jump on, but it's an important thing to think about. How does this affect the long-term components of an organization? All right, the fourth thing that we're talking about today is this thing called cultural whiplash. What does that mean? When there's like this trend adoption thing that goes on all the time, people think that it's like chaotic. There's this cultural whiplash. They look at change as instability rather than progress. You know what I'm talking about? Does it feel like sometimes in the world like now there's so much going on, so many priorities, that it's like I'm just whiplashing from one place to another, and it feels like the world is unstable. And people don't like instability. They actually want safety, they want predictability, they want to reduce uncertainty. And so that's why things like consistency matters. So one of the things about readiness might not be that it's a good innovation. It may be a great innovation, but people in your organization have seen too much whiplash from lots of things going and coming, lasting a short time, maybe lasting a long time and then dying. And to be honest with you, we just can't resist all change that's out there. Some of it's happening to us from external sources. So we need to think about it being consistent. Then there's the quiet damage. And this is the one that I spend a lot of time thinking about. It doesn't really show up on dashboards. It's something you really can't measure. And so me, the measurement guy, the QI guy that always wants to put some kind of objective value for it, is kind of lost. But we know it's there, and it's under this word called cynicism. Yeah, cynicism increases when we have a lot of failures, a lot of trends that kind of come and go. It's people get, not only disengaged, but they actually think that innovation itself is not a really good idea. We increase more of the laggards simply because we've not had good discernment and not made good decisions. Some trends really do deserve attention. Some ideas are very worthwhile. We're going to talk about those in a couple of weeks, but this really what we want to do is we want to be able to say these are the important ones, these are the less important ones, and sometimes the important ones aren't the biggest, most obvious things, but they have the longest durability, the longest impact. And cynicism just makes it harder for those good ones to gain traction. So the real danger of the wrong trend isn't just failure, it's the erosion that improvement's not possible, or improvement's not important, or improvement is secondary to just saying, let's have some less chaos, let's have some confidence in the world around us. So here's the part we talk about, what do you need to do differently? Here's a time for you to reflect a little bit about what's happening. The answer is not to reject innovation. That's easy. In fact, when you reject innovation, when you are risk averse, that's a decision. Believe it or not, no decision about taking on a risk is a decision, and it has its own consequences, and people notice it, especially if another organization nearby is doing the same kind of innovation and having wild success. They're like, what's happening with us? Why aren't we part of that trend going on? So just because you decided I can't tolerate the risk on this intervention doesn't mean you're doing the right thing. The real answer is, and this is the goal of viral healthcare, is to improve discernment, to improve your predictive batting average about the future. You're not going to always be right. You're definitely going to be wrong. There are so many things that are out of your control that will happen in the future that you can't anticipate. But we can get better. We can get a lot better by looking backwards, by looking forwards, by understanding the clear flags, and then setting up a process that allows you to understand just exactly when you should pull the plug and when you should keep going on it. So what are the few questions that get started to slow the momentum factor? So this is all about velocity and excitement and buzzwords. What problem is this truly solving? Do you have the ability to stay with this problem for more than a couple of years? I've seen so many organizations that have tackled a major transformative effect and think they're going to lick it within 1 or 2 years. And really, it takes 5 to 10 years to really have a dramatic organizational change. Can you last that long? Can you endure that long? Is your leadership effective for that long? The next question to think about is, what are we going to stop doing to make room for it? Because if you add on something else, something will lose attention. If you apply attention to another topic, something else is going to take that attention away. People only have so many ideas they can do. So you're either going to officially stop doing it or unofficially stop doing it. And most importantly, are we ready for this? Is this the time that's right for our organization? Now, you can use that as an excuse because there's always challenges. There's always, pain points. There's always burdens that you have to continually solve. So sometimes people use that as an excuse to doing it. But understanding and deeply understanding organizational readiness is one of the keys to being successful in this. So now, if this episode resonated with you, take a moment this week, take time to think about what are the initiatives gaining momentum in your organization? Where we might have some change fatigue going on, some initiative fatigue. Ask yourself this really simple question. Are we pursuing this because it fits our strategy, or perhaps because it fits the moment? That's something that's not always easy to distinguish, but I think if you ask it enough times, ask hard enough times, and go invite colleagues into the conversation, ask them. Always ask the hard question. Sometimes the most important part in leadership is knowing the right question to ask and when to ask those right questions. Nobody else is going to ask them if you don't lead the way in asking the tough question. Thoughtful implementation is the most powerful form of leadership in healthcare. That's just a rule. Thoughtful implementation. So it could be a great idea. It's going to fail if you don't implement it effectively. And we're going to spend some time talking about that on viral healthcare. So if you'd like to continue this conversation, come join me live every Tuesday morning on LinkedIn, or follow Viral Healthcare on the podcast platform that you really prefer and use on a regular basis. Here's another thing. I'd love to hear from you. I'd like to learn from you. I'd like to understand your examples of when things worked really well with a new idea, a new innovation, or maybe when you learned something about yourself, your organization, because you jumped on too quickly. Or what I'd really love to hear is, when did you officially stop? So many times organizations let sort of a bad idea just peter out. They don't pay any attention to it. They put all their ideas on all these other things. And when have you sort of stood up and said, yeah, we made a mistake on that one. It's time to move on. So here's what we're going to do next week. On the next episode of Viral Healthcare, we're going to start looking at specific healthcare trends. One in particular next week that's kind of exciting. It's a successful one. And in the future, we're going to look at the ones that worked, some that didn't, and what leaders can learn from both. The goal is to get this idea of discernment, your future predictive capabilities, to be better. Thanks for listening to Viral Healthcare. If this conversation was helpful for you, share it with a colleague who's navigating change just like you. And if you'd like more thoughtful conversations about the ideas shaping healthcare, be sure to follow the show. I'm Bruce Spurlock, and I'll see you next time.